Are you over 70 and think every checkup is helping you stay healthy? Think again. Some of the most common health tests prescribed to seniors might actually be doing more harm than good, causing unnecessary fear, risky treatments, or even triggering cancer. And here's the twist: doctors rarely warn you about this. Hi, welcome to Holic, your trusted guide to smarter senior living. In today's video, we're uncovering 5 medical checkups you may want to skip after 70, backed by solid research, real patient stories, and expert advice. You won't believe what made it to number 1. It's linked to as many cancer cases as daily alcohol use. Before we dive in, comment below with your age and whether you've ever regretted a medical test or treatment. We reply to every comment with tips that fit your health journey. Like this video, subscribe to Holic, and let's dive right in. Checkup number 5, bone density skin DEXA. It sounds simple, safe, and helpful, right? A scan to see if your bones are strong. But after age 70, this harmless sounding test often does more harm than good. Bone loss is part of normal aging. But when DEXA scans detect even mild thinning, doctors often rush to prescribe medications like bisphosphonates. These can lead to serious side effects: jawbone death, esophageal irritation, and unusual fractures. A landmark study in the Journal of the American Geriatric Society found these drugs reduced fracture risk by less than 1% in women over 70, while significantly increasing medication-related complications. Take Rose, a 76-year-old retired pianist. Her scan showed minor osteopenia. She had no pain, no falls, but she was put on bone medication anyway. Within weeks, she suffered severe reflux and jaw pain that forced her to stop playing music. Once she quit the meds and switched to vitamin D, resistance exercises, and calcium-rich foods like sardines, her strength returned. The safer alternative: lifestyle, strength training, balance work, a healthy diet, and vitamin D. These have been shown to reduce fracture risk by up to 20% without drugs. Checkup number 4, brain MRI for mild memory loss, a little forgetfulness after 70? That's normal, but many seniors are rushed into getting a brain MRI out of fear of dementia. Here's what most don't know: MRIs often detect harmless brain changes that come with age, white spots, or minor shrinkage that don't affect your cognitive abilities. But once doctors see them, a snowball effect begins: more tests, invasive procedures, and even surgeries that don't improve memory and may actually cause harm. One study in Neurology Today reviewed over 3,000 seniors with mild memory issues. A staggering 97% of MRI abnormalities had no connection to treatable conditions, but 12% were subjected to spinal taps, biopsies, or unnecessary anxiety. George, 74, started forgetting names and lost his keys a few times. His MRI showed typical age-related changes, but he was convinced he had dementia. He stopped driving, socializing, and became depressed. A basic cognitive screen later confirmed his brain was functioning normally. Lifestyle changes, not scans, got him back to normal. Better option: a simple cognitive assessment test. It's cheap, quick, and avoids unnecessary fear. Checkup number 3, cardiac stress test. If you're over 70 and only mildly tired or feeling off, a stress test might not be the answer. Often, these tests result in false positives that lead to angiograms, stents, or even bypass surgery, none of which may be necessary or beneficial. Research in JAMA Cardiology found that more than half of stents placed after stress tests were in patients who had no improvement in life expectancy or symptoms, but many did experience hospital complications, bleeding, or kidney injury. Raymond, a 75-year-old postman, mentioned he got tired walking up hills. His stress test led to a stent, which led to kidney issues from contrast dye and a 6-day hospital stay. His fatigue, it was due to dehydration and not enough protein, not heart disease. Unless you're having chest pain during activity, shortness of breath, or dizziness with exertion, ask for safer alternatives like a resting EKG or coronary calcium scan. Checkup number 2, Colonoscopy after 70. Colonoscopy is great in your 50s and 60s, but after 70, especially past 75, the risk outweighs the benefit for many. The prep is tough on aging bodies, the sedation can impair memory, and the procedure itself can lead to bleeding or perforation. In one study of over 1 million seniors, colonoscopies in people over 75 caused 10 times more complications than lives saved. Dana, a 73-year-old with no symptoms and a clean colonoscopy history, was talked into a new screening. The result: a bowel perforation, emergency surgery, and a 9-day hospital stay, all for a polyp that may never have caused harm. Safer alternative: a simple at-home fit test. No fasting, no sedation, no hospital stay, just real peace of mind. Checkup number 1. Annual full-body CT scan. It sounds like the ultimate preventive move. But full-body CT scans are one of the most dangerous trends in senior health care. These scans deliver massive radiation doses equal to 500 chest X-rays and often find tiny abnormalities that are totally harmless but spark a chain of anxiety, tests, and surgeries. A 2023 study found up to 5% of all U.S. cancers may be linked to unnecessary CT scans, on par with the cancer risk of alcohol. That's not prevention, that's provocation. Marcus, 80, felt amazing, but after a full-body scan at a luxury clinic, a tiny lung nodule led to a biopsy. The nodule was benign, but the biopsy collapsed his lung. He spent weeks recovering from something that never needed to be touched. Full-body scans are never recommended for symptom-free people. If you're well, skip it. If you're not, get a targeted scan based on symptoms, not fear. Modern medicine is powerful, but sometimes doing less is doing more. These tests can be helpful in the right context, but past 70, you must ask, if this test finds something, then what? If the answer isn't clear, or worse, leads down a rabbit hole of invasive treatment, it may not be worth it. Your best protection? Stay active, eat nourishing foods, sleep well, and avoid unnecessary procedures. Your turn. Have you or a loved one experienced a medical test that caused more harm than help? Share your story in the comments. Your experience could help someone else. Don't forget to like, subscribe, and turn on notifications for more videos from Holic, where we believe better health starts with better choices. Thanks for watching and take care of yourself the smart way.